Welcome to Part 2 of Module 1, Endometriosis Excision Surgery Explained. You are now under anesthesia. Something that may be overlooked in preoperative appointments, but that is important to note, is that after you are out, the position you will be placed in for the procedure is quite odd. It is called the Trendelenburg position. Yes, yikes. It's important to tell your surgeon beforehand if you have any issues with your joints, such as Ehlers-Danlos syndrome, arthritis, or similar, so they can be sure to bolster you with additional padding. This position is the best way for your surgeon to access the pelvic area, so know that it is medically necessary, even as it is pretty ridiculous to look at. Back to the procedure. A urinary catheter will be placed. This is a small, thin tube that is inserted into your urethra, and its job is to collect urine while you're incapacitated. No need to worry about wetting the bed. In addition to that, having an empty bladder keeps it small and less likely to be injured during the procedure. Depending on your surgeon and personal case, before the catheter is placed, a bladder investigation called a cystoscopy may take place. If this occurs, a thin tube with a light and a camera attached, called a cystoscope, will be inserted through your urethra into your bladder to look for signs of injury or inflammation. The urinary catheter will be removed at some point after surgery, depending on if you are planning to stay the night. If you are, it will likely remain in place longer, giving you more time to adjust and get up on your own. If your procedure is strictly an outpatient in and out situation, the catheter might be removed even before you wake up. Removal is uncomfortable to say the least, should you be awake for it. Try to take a deep breath and exhale as the nurse removes the tube, as this will relax your muscles. Being able to go to the bathroom on your own is the main milestone for being able to leave the hospital or surgical center after your procedure. So the sooner the catheter is out and the sooner you can go on your own, the sooner you get to go home. Moving on. An incision will be made in your belly button with additional incisions made around your lower abdomen. These incisions will be how the surgeon, with the assistance of the robot, will perform the surgery. Tools will be brought into your abdomen and pelvis this way, and any excised biopsies will be brought out this way as well. The majority of the procedure is an investigation of your entire pelvis and abdominal cavity. In order to do this, the surgeon will use a special kind of gas to fully inflate your abdomen so there is space for them to see everything. Notably, they will have to insert a special tool called a vaginal manipulator into your vaginal canal in order to safely move your uterus from the inside to be sure that no endometriosis lesions are hiding in or around it. The vaginal manipulator insertion or removal may cause some bleeding, but it should be nominal. However, it's important to bring up, as you will likely wake up with a pad or disposable underwear on, and this may be jarring. If bowel endometriosis is suspected, a bowel manipulator may be inserted rectally as well. However, this is a much more rare occurrence. These tools, while uncomfortable to think about, are medically necessary in order to fully investigate your anatomy. If you have a history of sexual assault or have any concerns about these tools being used, talk to your surgeon. Your well-being is the priority for this surgery, so speak up if you are distressed by what may happen while you are under anesthesia. A solid surgical team will listen and work with you to explain in more detail to alleviate any anxieties. If you are having a hysterectomy at the time of your surgery, no manipulator will be used, and the area will be investigated at the time of your uterus removal. As the surgery proceeds, your surgeon will thoroughly explore for traces of endometriosis. Lesions appear in different sizes, colors, and textures. When one is found, it will be excised, meaning it will be cut out at the root and removed. It will be sent to pathology as a biopsy sample. Additional phenomena are often observed and corrected at this time. For example, if you have cysts, they will be drained or removed. Also, very commonly, scar tissue adhesions may have formed between organs, and this will be cut down so that your organs are freed. If you have chosen to have any additional procedures, such as a hysterectomy, fibroid removal, or similar, this will happen now as well. Appendectomy may be performed as endometriosis is sneaky and can affect your appendix as well. You can and should talk to your surgeon before surgery about any additional procedures you'd like to choose to have at this time, and also what your personal case means you should expect. Be aware as you sign consent forms what you are agreeing to in terms of procedures. If it is not in writing, it cannot legally happen during the surgery. No one is going to take your appendix out just for fun. That being said, there will likely be a clause in your forms stating that emergencies happen, and you will need to consent to emergency care in order to have the surgery in the first place. This means that if something unexpected is found or happens during the procedure, that you consent to the surgeon providing you with emergency care. Please see the bonus module of this course for more information about what additional procedures often occur alongside endometriosis excision surgeries and how to discuss these with your doctor. When all endometriosis lesions have been excised and all concurring procedures have been completed, your surgical team performs a very thorough check to be sure that all sutures are secure and all surgical instruments are accounted for. Very often, people fear what they can't see. Be assured, your surgical team will make sure you are safe and your surgery complete to the best of their ability before they wake you up. You'll then be transferred to recovery. As you wake up, you will likely feel groggy and uncomfortable, but should not be in any pain. If you are in pain, speak up as soon as possible. Soreness and bruising are to be expected. Anything sharp, stabbing, or unrelenting is not. If you are staying overnight in the hospital, make sure that your doctor has ordered IV fluids to be continued. Remaining hydrated is crucial, especially as you will not be released from the hospital until you are able to go to the bathroom on your own. Once you are sufficiently awake, your support person will be allowed to see you. Nurses will check your vital signs. Your surgeon will check on you and give you an update on any preliminary findings. You should anticipate that the grogginess from the anesthesia will make paying attention at this time very difficult. Ask your surgeon during your pre-op appointment if you can record what they say after your surgery so that you can play it back at a time when you are better able to understand it. If that's not an option, this is when having a support person comes in handy, as they can take notes or otherwise be helpful in remembering what was said after your procedure. You should receive the pathology report from the biopsies taken within 7 to 10 business days, and your surgeon may also provide you with a report of the findings. At any time after it has been generated, you can request from the surgeon, hospital, or surgical center the actual surgical report of your procedure, and I highly recommend this. This report is required for all surgical procedures and details step by step everything that happened during the procedure. It is very technical, as it is an official report in your medical record, but for me, it was the most comforting and affirming, as it notes in full detail everything that was seen and done during surgery. Once you are able to get out of bed, sit in a chair, walk down the hallway, and go to the bathroom on your own, you will be released from the hospital or surgical center. You did it, and I'm so happy for you. Now you get to go home and enjoy the recovery space that the rest of this course will help you set up. As for now, I'll see you in the next video.